Hi, everybody. I'm here to talk a little bit about our updates for the end of 2023 in the Department of Medicine. There's certainly been a lot going on, and I want to give you some of the highlights. Now, I will also note that I did provide a small holiday message for all of you separately, so please look out for that so we can hear a few words about the next few weeks as we all try to wind down and try to enjoy the holidays. In the meantime, here are a few points that I wanted to make about all of the exciting things that have been going on this month in the department. One of the big events, of course, is on November 17th. We actually had two important items. One is it was the 4-year anniversary of the opening of 500P. Now, with 500P, shortly after came the pandemic. So we were very fortunate to be able to have 500P as well as to be able to repurpose parts of 300P so that we could really deal with the big surge that we saw during that period of time. Even our new parking garage served as a COVID testing site. And it's also important to note that the emergency department also saw huge numbers of patients during that time. And in fact, that leads me to the second point around the other landmark that happened in November. And that was the same day as the anniversary of our opening of 500P. And that was a record-breaking census for the hospital on that day. And in fact, even after the pandemic surge, we've seen numbers continue to go up and fluctuate a bit, but generally stay higher than the pre-pandemic time. So I know how hard you all must be working, and I really am grateful for the work you're doing. And it definitely shows because people continue to express gratitude for the work that all of you are doing. I hear it walking in and out of the hospital. I hear from patients and their families about what a tremendous job you are all doing. So I'm grateful for that. I want to also remind you that this is flu, RSV, and COVID season. It's respiratory virus season. And we do, as you recall, have a mask mandate for all patient care areas that is given to us by the Santa Clara County Health Department. So please remember to wear your masks in all clinical areas. Because we want to keep our patients safe, the staff safe, all of you safe, and our community members safe as well. Another bit of good news, on November 29th, we had our fellowship match day, and our residents did fantastic. 38% of our residents are going to stay at Stanford for a fellowship, and of the 15 that are going elsewhere, they will be spreading out to 13 programs around the country, including the Brigham and Women's, Johns Hopkins, and the Mayo Clinic. And I also want to congratulate our residency program directors and house staff. And some final bit of good news in that realm, we also saw our fellowship programs here at Stanford fully matched in the Department of Medicine. So that is something for all of you to be proud of, knowing that you have done a wonderful job in modeling for residency applicants and fellowship applicants who are coming here and being excited to want to join the fellowships here at our institution. So thank you for that. We also have announced a recent spate of our very first Team Science Initiative Pilot Seed grants. These grants provide opportunities for clinical faculty to engage in research. They consist of $50,000 in funding per year for the recipients of these grants. And we mean for those to build a foundation for future larger grant proposals. This year's recipients are Daisuke Furukawa, Linda Gang, Ron Lee, Fazia Riaz, and Jorge Salinas. We'll link more details to you about the pilot grants and the projects, and congratulations to the recipients, and we look forward to more success as we roll out additional pilot grants next year. On a bit of sad news, I did want to mention, as you all probably know, that Kathy Gario, our beloved Kathy Gario, will be departing Stanford Medicine at the beginning of the year. Kathy will be joining Bob Harrington at Weill Cornell Medicine, where she will be serving as Executive Vice Provost and Chief Operating Officer. And Kathy's last day here, sadly, will be January 11th, 2024. I want you all to, if you get a chance, to wish her well And we will obviously hope to see her again in the future and wish her all the best in her next steps. Now, in the meantime, we will have an interim leadership from Galina Malakina, who is our Director of Finance, and from our Chief of Staff, Helena McCombie, who will be my primary points of contact during this transition. We will be working with the School of Medicine to begin a search for a new replacement for that position that Kathy will be vacating, and we hope to have more news for you around that sometime in the new year. We do have an expert team of executive search executives in the School of Medicine who will be helping us with that role. So thank you very much for that, for your patience. And just one last point. This is the final interim chair report for 2023. There's always so much happening in and around the department. I know more events will happen before the end of the year, and I hope I'll be able to give you more updates in January. In the meantime, please send me notes if you have ideas, things that you would like me to announce and make the rest of the department aware of. I am so happy and thrilled for your support as I serve as your interim chair of medicine. And I wish you all a happy holiday season. And please look out for that holiday message as well. Please take care of yourselves and get a bit of a break during the holidays to spend with your family and friends. Thank you so much.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.